Canada a droit à un avortement.
All Canadian women have a right to safe and legal abortion.
From supporting women's rights here in Canada and around the world. I am reminded of a few years ago when, as Ontario's Attorney General, we worked with activists and women's rights groups and helped pass legislation that created safe access zones around abortion clinics, such as one down the street right here on Bank Street in my riding, so that no woman has to face interference, intimidation, or harassment when accessing abortion and reproductive health services. This law remains in place today to further protect women and their rights. Today, we are joined by two incredible organizations: Action Canada for Sexual Health and Rights, whose mission is to uphold reproductive and sexual rights and health in Canada and globally. We also welcome the National Abortion Federation Canada that promotes and enhances and ensures access to quality abortion care. Nous avons la chance de voir ces incroyables.
We are lucky to have these incredible organizations here with us. They work day in and day out to promote the rights of women and to guarantee the right to access abortion services. With pleasure, I will now introduce the Honourable Jean-Yves Duclos, the Minister of Health.
Minister of Health, Duclos.
Bonjour à toutes et à tous.
Hello to everyone.
And thanks for joining us. Today, I'm joined by my colleague, the Honourable Marcy Ian, Minister for Women and Gender Equality and Youth, our colleague, Yassir Naqvi, who is MP for Ottawa Centre in this particular riding, Frédéric Chabot from Action Canada for Sexual Health and Rights, and Jill Doctoroff from the National Abortion Federation Canada for an important announcement. In Canada, everyone has the right to safe and consistent access to reproductive health care, including abortion services. In other words, in 2022, in this country, sexual and reproductive rights are human rights, plain and simple. Pour de bonnes raisons, en ce qui concerne les droits.
For good reasons. When it comes to women's rights and individual rights, we are proud of the progress that we have made throughout our history. That said, we do know that we cannot rest on our laurels. We can't take these rights for granted. As you are aware, in Canada, the right to abortion services was won after a good deal of efforts, decades of fights by the feminist movements and those supporting them. The Supreme Court has clearly decided that the provisions of the Criminal Code, which in the past forbade abortion, were anti-constitutional, were unconstitutional. In the Tremblay decision, the court then recognized in the next year that it was up to women, and solely women, to make decisions about what they wish to do with their bodies. These legal victories were both fundamental and revolutionary. Even though these victories are well remembered by all Canadians and our legal system, the situation now ongoing in the United States does remind us that we cannot take our rights for granted.
Abortion is closed in this country, but that doesn't mean that the fight is over. The legal battle has been won, our regulatory framework is strong, and yet, for too many Canadians, access to abortion remains a significant challenge. Access, that is where our efforts should be focused, and that is why we are here today. Même si certains souhaiteraient nous ramener en
Even though some would like to turn
juridique est clos, et que la liberté et le
the
libre
legal
choix des
debate
femmes
is done and over in Canada, and that women have won their rights. Nevertheless, this doesn't mean the fight is over. The legal and framework about abortion is solid, but across the country, access to abortion services is unequal. So we must focus on accessibility. And it is for that reason that we have gathered here today. We do know that still today too many barriers exist for women wishing to access abortion services. Accessibility, lack of money for transportation, lack of information, or assistance accompaniment, for example.
By making the already limited healthcare resources even more stretched. This continues to affect the sexual and reproductive health services across our country. Today, we are here to reiterate our commitment to protect, promote, and improve access to reproductive health services across the country. Aujourd'hui, nous sommes ici pour réitérer.
Today, we're here to state once again that we are fully behind the protection, the promotion, and improved access to reproductive health access across the country.
No matter their circumstances, should have access to comprehensive sexual and reproductive health care, and that includes access to safe, accessible, and stigma-free abortion services. J'ai donc le plaisir d'annoncer aujourd'hui du financement pour.
So it's with pleasure that I wish to announce funding for two important projects managed by Health Canada for sexual health and rights, as well as the National Abortion Federation of Canada.
Supported through Health Canada's Sexual and Reproductive Health Fund, will improve access to important reproductive health care services, including abortion services. Action Canada recevra un financement de plus de 2 millions.
Action Canada will receive over $2 million in funding to improve access to reliable information about abortion services, including information about competent professionals.
Abortion Federation of Canada will receive more than $1.4 million in funding to provide financial and logistical support to those seeking abortion services. It will also train healthcare providers in abortion provision and support facilities to maintain the capacity to provide related services and care. These investments reflect our belief that women and women alone have the right to make decisions about their bodies, as well as our unequivocal commitment to ensure comprehensiveness and accessible reproductive health care for all in Canada. Avec le financement annoncé aujourd'hui,
with the funding announced today, we will continue to fight against all barriers that prevent access to safe abortion.
Projects that the $45 million fund committed and announced in Budget 2021 will allow us to support. My colleague, Minister Ian, and I will soon have the pleasure of confirming additional investments in similar projects across the country. Merci, Ministre Ian.
Thank you, Minister Ian.
Merci, Minister Duclos. It's my pleasure to be with you today, and MP Nakbi. So good to be with you today. I want to begin my remarks with acknowledging that we are gathered on the traditional territory of the Algonquin and Anishinaabe people. Hello, everyone. Bonjour. Jill Doctoroff from NAF, Frédéric Chabot from Action Canada. Delighted to be with you here as well for this important announcement. Et merci à tous pour votre travail important.
And thanks to all of you, especially for your important work and support.
And gender equality in youth. I want to be crystal clear. I'm committed to protecting the right of people in Canada to access safe and legal abortion services. Crystal clear. Generations of women have fought for far too long, fought far too hard to have these rights slip away at the hands of a minority who mistakenly believe that women should not have agency over their own bodies. Our position is appropriately summarized by what the Prime Minister said earlier this week. The freedom of a woman to choose belongs to her and her alone. But that choice is more than just ensuring the abortion is legal. The freedom to choose also means having access to these services, no matter who you are or where you live in Canada. Mais c'est là que nous avons du travail.
But this is where we have work left to be done.
The advocates that are here today, Jill, Frederic, and their organizations, they know that far too often, LGBTQ2 people, Indigenous, racialized people, women and youth face barrier after barrier after barrier when trying to access sexual and reproductive health care services. And despite abortion being decriminalized more than 30 years ago, those who live in remote areas accessing these services is even harder. These barriers often come down to logistics. They come down to finances for these underserved communities. Not everybody has money to travel for these services. Not everyone has a car. Not everyone can take time off work. But let's be clear. No one should be denied an abortion because it is too far to travel or too difficult to coordinate an appointment. We know that we have to do better. And that's exactly why we're here today to announce these projects that will address these real-life barriers faced by intersectional communities by assisting with travel and accommodation costs and connecting people with the resources that they desperately need. For generations, the women's movement and organizations from coast to coast to coast have worked to improve and protect access to sexual and reproductive health services. And we are here today to send the clear signal that this progress will not be reversed. Not now, not ever. Our government will continue to work alongside organizations that support a woman's right to choose and organizations that believe everyone should have a chance to fully participate in Canada's social, economic, and democratic life, regardless of their gender, gender identity, gender expression, or sexual orientation. Nous croyons que chaque personne devrait avoir accès aux
We believe that everyone, all women, should have access to the services they need, whatever their situation, their circumstances, or their ability to pay for services. And abortion services are one of those services.
announcement is a step in the right direction, and it most certainly is. We must never, ever let our guard down. We must never allow anyone to turn back our progress. And we will continue doing everything in our power to make sure that we keep moving forward. Thank you. Merci beaucoup. Jill, it's over to you.
Thank you very much, Minister Ian. As I said, my name is Jill Doctoroff. I use she and her for my pronouns, and I'm the Executive Director of the National Abortion Federation Canada. NAF Canada promotes, enhances, and ensures access to quality abortion care. And some of the ways that we do that are through training and education for healthcare professionals and helping people who have access barriers to the abortion care that they need. And so we're really grateful for the funding that we'll be receiving from the federal government through Health Canada to support those programs. So currently in medical schools, in nurse practitioner programs, and in midwifery programs, there's very little or no training around abortion care. So healthcare professionals who are going to be providing the healthcare that people need don't have the information. So we provide ongoing training for folks who are involved in providing abortion care, and a few years ago identified the gap in this training for people who might be interested and have developed some training programs, and will continue to develop training programs. We'll also be working with medical schools, nurse practitioner schools, and midwifery programs to help them incorporate abortion care into their training. And currently, if somebody wants to learn how to do procedural abortion, they rely on connections, if they have any, the generosity of people who are currently providing abortion care. There is no hands-on training program for family care physicians, and very little for obstetricians and gynecologists. So we'll be creating a hands-on aspiration abortion training program. And this is really important because to ensure access, we need to have the healthcare professionals who support and who are trained to be able to do the procedures. Another thing that we'll be working on and continuing to work on, up until now we've relied on the generous donations of Canadians, and now we'll be receiving some funding to actually help people travel. So there's lots of parts of the country where we have limited access to abortion care. If you live in the Maritimes, you can't access abortion care past 16 weeks. Where you live in the country shouldn't be something that determines how much health care or what kind of health care you get. So we get calls on a regular basis. We had over 150 people reach out to us last year alone, looking for support of where they can get abortion care and also help to get them there. We also help Canadians leave the country to access abortion care in the United States past 24 weeks because it's very difficult to access abortion care in the country at that stage. And those costs can be prohibitive for people who are regular Canadians living their lives and don't have a lot of finances. So those are some of the things that we're going to be doing and continuing to doing to make sure that access isn't an issue for people who need abortion care. And I think I'll pass it over to you now, Fred.
Thank you. It's a real pleasure to be here with all of you for this historic announcement. My name is Frederique. I use she, her pronouns. I'm the Director of Health Promotion for Action Canada for Sexual Health and Rights. We were formerly known as the Planned Parenthood Federation of Canada and also as CORAL, the organization that fought alongside Dr. Henry Morgentaler for the decriminalization of abortion in Canada. We are a charitable, progressive organization committed to advancing sexual and reproductive health and rights in Canada and globally. We are active at the Human Rights Council since 2012. Building on the 50-year legacy of the organizations that formed Action Canada, we work to promote health, equity, well-being, and human rights related to sexuality and reproductive care. Anchored by our frontline services, Action Canada advances rights-based policies to improve access to abortion, stigma-free healthcare, gender equality, LGBTQ+ rights, inclusive sex ed, among many other issues that intersect with bodily autonomy, gender, sexuality, and reproduction. Our frontline services include a toll-free pregnancy information and referral service paired with a national abortion access financial aid program called the Norma Scarborough Emergency Fund. We speak to thousands of Canadians every year, and since January alone, we have supported over 70 people to get to their abortion appointments in collaboration with our partners at NAF Canada. And so we pay for train tickets, for plane tickets, for food, for taxi, for childcare, for pet care, for passport fees, anything that stands in the way, we are there to help and to help coordinate complex appointment logistics. We also have a sexual health information hub where people in Canada can access accurate, non-judgmental information about sexual and reproductive health, including abortion. This is to combat abortion disinformation and the kind of lack of information that people have around sexual health that is key to act on health decisions. Abortion is basic health care and it is normal. In Canada, 1 person in 3 who can get pregnant will have an abortion in their lifetimes. It is not always treated as such. While the need for abortion is common, access to safe and legal abortion services is far from guaranteed for all who may need it. As we witness the overturning of rights in the United States and global attacks on women's sexual and reproductive rights in Hungary, in Poland, in Russia, in the United States, we know that we must do everything we can to stand up for abortion rights in Canada and around the world and break down the barriers to meaningful and dignified abortion care for everyone who needs it. Because what is the point of having a right to something that is impossible to access? What is being pro-choice without real, tangible choices? In Canada, making sure abortion is accessible to everyone is the conversation that matters, as both ministers pointed out. This is what we need to be talking about. While Canadians strongly support unrestricted access to abortion care across party lines in the public, many people still face serious barriers to care or fall through the cracks. Those who do are often the most marginalized, those who live in rural or remote communities, who are undocumented, are low income, or face racism or discrimination in the healthcare systems. We are very proud to partner with Health Canada for a project called Access for All, funded under the new Sexual and Reproductive Health Fund, to continue and expand on our work. This is work that matters. Thank you.
Merci beaucoup pour la période de questions.
Thank you very much for the question period. I'm told that, unfortunately, we have only 20 minutes.
Ask everyone to keep the questions and the answers very short, please. We'll start in the room, after which we'll go on Zoom. So we'll start with Elie Quentin-Nantel, True North.
Good afternoon. My question is for Minister Ian. Minister Gould said that American women could come to Canada to get an abortion if Roe v. Wade is overturned, and Minister Menachino said that he alerted border agents that American women were welcomed. So my question, will unvaccinated American women who want to come to Canada to terminate their pregnancy be allowed in?
Thank you so much for the question. And as Minister Gould reiterated, Americans who come to, said before, and I will reiterate, Americans who come to Canada are able to access medical services here if they need it. They can access healthcare services in Canada. They will have to continue to pay for the service, though, out of pocket by their own private insurance, and that's important to note. If they are not covered by a provincial health insurance, or by the interim federal health program, or not insured health benefits.
So the data from the KFF shows there is a lower vaccination rates in certain marginalized groups in the United States who also have a higher reliance on abortion services. So again, would those unvaccinated women that may be in marginalized communities be able to come to Canada to get an abortion?
That is something that we will deal with. I don't deal in hypotheticals, but that is something that we will deal with in an empathetic way when and if the occasion arises.
On passe à Valérie Gamache, Radio-Canada.
Over to Valérie Gamache, Radio-Canada. Hello, Honourable Minister Duclos. Prime Minister Trudeau said this morning that there might be a bill to protect the right to abortion services. Is this something that is being studied, and what do you think of the possibility of having this legislated? Very good question. Everything is on the table at present, but let's perhaps begin with clearly stating where we're at right now and also discussing what we might do more. The legal framework in Canada is very clear. The courts have been very clear on the right to choose. It's a right that's protected by the Canadian Charter of Rights and Freedoms as well. The Canada Health Act is very clear. There are 5 principles that apply to all health care services, including sexual and reproductive health care. And rights to reproduction are clear. And this makes it easier for the different levels of government to work together in Canada. Now, we do hear varied points of view about what might be done to strengthen this legal framework. Some think it might be a good idea, given that there's no specific legislation about the protection here. There is a court-decided protection, of course, but there's no actual legislation. Some think it might be a difficult road to take, given that there is no legal issue at present. The right to abortion services is already protected. And if we were to push further and try to provide legislation to this effect, there might be some concerns. Legal experts tell us about representation thereafter, because a right that is stated explicitly in legislation does come with a number of considerations that might actually restrict the current use of abortion rights, which is based on case law. So some feel this wouldn't necessarily be the right approach to ensure and guarantee access to abortion services in our country. I'd like to hear you on the matter of the timing of this announcement. This is kind of a blowback after the Supreme Court justices' discussions, or is there something about the debate in the Conservative camp about this, or are you trying to throw this back into their camp? Well, 2 points here. First, no, this is a 2021 budget commitment, And we are happy to announce some of the results of that budget decision today. There are two projects we've mentioned, two important organizations in our region, which will be able to help on this issue across Canada. This is only two projects of a number of projects that we hope to announce very shortly. It's also a first phase of this investment, 45 million over 3 years, so 14 million is now earmarked, and 3.5 million being announced today. There will be another announcements soon and over the coming 2 years to explain what is being done with the investment announced in the 2021 budget. We all know that we in Canada and elsewhere must defend the rights of women's rights, and that's what we're doing here today. And we expect that other political leaders, other elected officials, economic and social leaders as well in Canada and around the world do as much. It's an important question. How can we work together to ensure that this right that is now protected ongoing and defended ongoing, but not only the right, but also access. Yes, it's very well to have the right to choose, but then you have to be able to choose. It's important to have the right to choose, but it's important to actually be able to meaningfully choose. And as Jill and Fred have told us, in 2002, this is not universal access in that sense across Canada.
Two things. First, the fact that this is an important announcement, but not the end of the announcements. As you will have understood, these are two projects out of a total of 9 projects that we have been able to engage on with a large number of important, credible, and strong organizations across Canada over the last few months, following the commitment of Budget 2021 of $45 million over 3 years. This $3.5 million announcement today is only 2 projects out of 9 projects. The 7 other projects we are hopeful to be able to be more specific on very soon. 14 million in total for the first year out of the 3-year commitment of $45 million that will come. Now, the second thing is around in our responsibility as elected leaders, but also as community leaders. And I insist very much on community leaders who actually do the real work on the ground. They are collective and individual responsibility to keep defending not only the freedom to choose, but the ability to choose. And that is a collective responsibility. Every political leader and everyone in the House of Commons has the duty to defend that right, I believe, at least. And we all have the duty, as I said, not only to defend that right, but also to make sure that it is actually possible to access the reproductive and sexual health services that are human rights and absolutely essential health services in 2022.
Canada's Minister of Health, Jean-Yves announcing more than $3.5 million to improve access to reproductive services, including abortion.